by Dr. Manoj Ramugade. This webinar is arranged by ADC Webinars, Mumbai, which is headed by Dr. Doe, sir. So I'll run you through a brief introduction of Ramugade, sir, our speaker for today. He has done his BDS from YMT Dental College and Hospital, Mumbai. He has done his MDS in Conservative Dentistry and Endodontics from GDC, Mumbai. He has done his MA in Marathi Literature from Yashwantrao Chauhan University, Nashik. He has done his LLB from Mumbai University and is currently pursuing Masters of Laws from Mumbai University in Criminal Law and Criminal Administration. Talking about professional and academic experience, he's worked as an assistant professor at Department of Conservative Dentistry and Endodontics at GDC, Mumbai. He has worked as an assistant professor in Department of Conservative Dentistry and Endodontics at Nair Hospital, Mumbai from June 2011 to August 2015. And he's currently working as an associate professor at the Department of Conservative Dentistry and Endodontics at GDC, Mumbai, a post which has been appointed to him through MPSC, the Maharashtra Public Service Commission, as you all may know. So this is a big achievement on the part of sir. He's a life member of IDA, an active member of IAS, Indian Endodontic Society. He's also an editorial board member of the following journals: International Journal of Dental Research and Oral Sciences, Acta Scientifica India; Matthews Journal of Case Reports, USA; EMS Clinical Case Reports Journal, USA; Oral Health and Dentistry, USA; Journal of Pediatric Dentistry and Hygiene, USA; Journal of Dentistry, Oral Health and Preventive Measures, UK; Journal of Research Notes, USA. And he's also a reviewer of the following journals: SRL Journal of Dentistry, USA; International Journal of Education and Research in Health Sciences, India; MUHS Sciences Review, which is the official journal of the Maharashtra University of Health Sciences, Nashik. Talking about his professional activities, he has conducted a number of lectures and workshops. He has conducted a hands-on on direct composite veneers at GDC Hospital, Mumbai. He has been he has conducted a lecture come hands-on rotary endodontics at GDC at Mumbai. He has conducted a lecture on problem solving, cleaning and shaping. He has done a hands-on workshop on direct composites and veneers at Nair Hospital and Dental College. He has conducted a hands-on workshop on rotary endodontics with Dr. Ajit Kotnis at Nair Hospital and Dental College, and many more such things. So we have an esteemed guest with us, and one who can lead us through the medico-legal concept in dentistry. I'm proud to have you, sir, today. Please, over to you, Dr. Ramugade, sir.
Welcome, thank you, sir, for the introduction. I will directly start. I will share my screen. Is it visible, sir?
Yes, sir, visible.
Okay. So basically, this is my disclaimer. That this presentation is not itself a law, but it is my legal opinion, what I have studied from my experiences through LLB and LLM. There is no commercial or promoting purpose of any legal or dental product or services. My pure goal is to make the people of the dentistry aware of such legal terms and conditions and medical legal aspect of dentistry. Now, this is about the lecture. This half-an-hour lecture or 1 hour lecture will change your thoughts and vision, what you see your dentistry as a profession. Okay, it will save your time. It will save it will save your money in the future. Okay, it is my legal advice that for any legal help, basically, you have to kindly contact your legal professional advocate. Don't be a legal advisor of yourself, because as you know, you may be the master of your subject, but you may not be the master of the legal terms or the legal background. The lecture is based on the facts and the cases in the past, which are considered as a landmark cases in the medical legal field. Now, every medical legal case is different and every judgment is unique. As you know, what we studied in our dentistry, there is a protocol, like how I will give example. There is a BMP, there is a concept called as a biomechanical preparation and obturation. There is a concept and protocol. So through the books, we have followed the procedure. But in dentistry or in legal terms, basically medical legal terms, when any judgment comes, it acts as a precedent for the future judgments. Basically, for the future cases, that judgment can be taken as a reference, and the future of that case, particular case, would be based on that particular case. So basically, what are the facts and myths? As you're aware of the various encounters which have been by the uh, patients, which are usually we are safe, but the medical professionals who are there are encountered or mollified by the people unnecessarily. And these are the some cases where you can heard of the fine by the court, which is given by the up to nominal fees like through 2 lakhs, 3 lakhs, whatever. So these are the some cases which can be considered as a major setback for our profession due to the lack of the knowledge. Now, if you consider this image, what you consider this image is a pure professional who can be considered as a uh, person with a ethics, with a dignity. Okay, it is a character of the integrity and character. But a small dot which is there, okay, which is there, we can see a black dot exactly on the white coat. Though the coat is very much white and it is broad, but we can see the black dot. Like this, when a person alleges on your character, on your profession, usually other people also see that particular thing, not what you have done good for the other people. Okay. Now, my content of the lecture is some cases of the negligence as related to our dentistry. Then some facts about the dental cases which is considered as a negligent in India. Then what is consent record keeping. Then CPA, that is Consumer Protection Act. It is also called as COPRA. Then liability of the dentist in such cases. Then indemnity insurance. Then how you can tackle a medical legal case and legal advice from my side. Okay, so we'll start with the case where a negligence can be found or negligence can be elaborated. Now, see, this is the case one. In your clinic, a 36-year-old male patient has pain after RCT with 3/6. In emergency, he went to the another dentist where he told that a 3/6 needs to be extracted due to the improper RCT and the tooth was extracted there at that dentist. Okay, the patient returned to you and demanded refund of the money and threatened you of filing the case of the negligence. In such case, what you will do? First, you have to see what you can do. First, points to be remembered in such cases that whether you have taken a particular informed consent for the patient before starting the procedure and the complications of the root canal or the procedure which you are going to do on that particular patient, have you explained in that consent? Then patient, whether the patient has been given any chance to have root canal or the extraction for that particular tooth. Then do you have any pre-operative records, intra-operative records, such as IOPS, or you may have a CCTV footage, or any mishap or the negligence from the dentist side, if you find out, then pain after RCT. Is it possible? Now, it is a well-known fact that whether it is a single-rooted RCT or it is a single setting RCT or whether it is a multi-setting RCT, there is pain is expected in both the cases. So it is a known fact and it is proven in the literature that it is possible. So the literature or the publications have already proven that the pain might have after the root canal treatment. Then, do you have any expert opinion of that particular field? Like if this is the case of the RCT. So the expert opinion in that case is available to you, or is it easily convenient for you to get that opinion? Okay. Now, how this case, if the particular patient has gone to the court or gone to the superior authority, so how will you treat that case? The court, how will that case will be treated? First, the some facts will be checked by the court. First is that whether the court will ask that whether you have taken the informed consent or no. Okay, if yes, then if there is no negligence on that part. If no, then there is a negligence. First, whether the specific consent, there is a specific procedure specific consent, or it is a blanket consent. Now there is a difference between the procedure specific consent and the blanket consent. Blanket consent when the patient comes to you and you ask him to fill the form, and there is the form which has been filled for the checking up of the patient, not for the particular procedure, whether it is for the extraction, whether it is for the RCT, whether it is for the prosthesis. All these is called as specific consent. So if any procedure has to be performed, you have to take the specific consent. Is all the requisites of the consents are involved. As I said, you have to give the option to the patient whether the tooth can be extracted or whether it can be saved, and what are the complications may arise in that particular procedure that you have to mention in that consent. Now, this is the normal flowchart of the consumer complaint. When any patient file a complaint in the consumer court, what he will do, the complaint will be filed. Okay, either it is the police station or the court directly, the district forum. That is, then that forum, that court may accept or reject on the prima facie. If a court sees that if there is something which can be evaluated, then court may accept the application. If accepted, then legal notice will be sent to the respondent, that is the dentist, within the 21 days. Okay, with the and give the compensation. The court may directly ask you, or it may be rejected. Okay, the court may ask to represent yourself, the dentist and the patient, and when it is rejected, then reply has to be given to the court within the 30 days. Okay, then mediation. You can directly go out of court settlement. You can do, or the court appoints some mediator or arbitrator to give to consult or and reach the consensus, and the compensation can be managed. Okay, and if this procedure fails, then the court asks the party, both the parties, for the proof for the hearing, and it may require, if it is required, for the expert opinion, like the opinion in this case, the opinion of the endodontist, and in other cases, the opinion of that particular field. Okay, and usually the consumer complaint can be entertained, can be completed within 3 months or within 5 to 6 months. It may depends upon whether if the some reports or the some sort of expert opinion is required, then it may take 3 to 5 months. Okay. Now, how to settle this matter? Basically, when the patient comes to you, how can you settle this matter? First, don't be panic and don't pay the amount directly to the patient. If you pay it, then once a deal, there is always a deal. If you pay once, then the patient will know, okay, that the doctor, if it fails, he will give my money back. So he will tell to the other people, okay, that you go to that doctor, he will pay. If anything happens, he will pay. So your reputation will be like that only in the society. Okay. So discuss the matter with your specialist. You take the opinion of the specialist of the particular case. Then, if you think that patient, your fault is there, or the patient is very nagging, or which patient is there, then try to settle that matter at your level. Try to settle. How can you settle? Either you compensate with the money with the other treatment of the patient or the family person, or you can give a refund. But in my opinion, don't give the refund. Once refund is given, that a patient usually feels that his treatment would be given free of cost at all the times. So better you can settle or you can negotiate with the patient for the other treatment option. Okay, and next time when you know that the patient is not convincing or the patient is not good according to your expectations, then don't entertain the patient, but try to refuse the patient politely. Okay, so why my word of advice would be, usually first is that don't give any adverse comment on the work done by the previous dentist. Okay, what happened, when the patient comes to you in our clinic, if the patient comes to you, I'm a specialist. So usually there are cases of the re-RCT. So usually I don't comment on the particular work. I usually tell that this work is good according to that particular time. I don't know the condition what you have with that particular time. So I tell the patient, that condition, when you meet that dentist, that was might be good. Okay, but now there is a problem. That problem has come because of various reasons. I cannot tell because of the bad work or something, but that might problem or the condition of your tooth is bad now. So don't blame the other dentist. Okay, once you joust or the bad mouth for the other dentist or colleague dentist, so ultimately that comes as a boomerang, and ultimately some other patient will or some other dentist will joust against you. So don't give derogatory comments or see if any senior person is there, senior dentist is there, and your patient has gone there. So that senior person should take care of that. He is a good doctor. He's good doctor. You can say that senior person can say, हाँ वो senior person क्या बोलता है फिर कि अरे वो तो नया नया डेंटिस्ट है वो ऐसा ही करेगा. See, this is called a bad mouthing. And junior doctor says, अरे वो तो बुड्ढे हैं उनका उनका पैसे प्रैक्टिस पहले जैसा ही है अभी भी चेंज नहीं हुआ है. So don't say like this. So say कि this that particular treatment has been done good according to that particular period. Okay. Say keep the mutual respect and dignity of our profession. See, dentists should respect the other dentists. Otherwise, people also will not respect you. So what you have to do, you have to customize your consent form. Basically, you have to customize your consent form for RCT, extraction, minor surgery, ortho, like what new treatment you are doing. Customize according to your needs. Okay, need to explain the contents of the consent. See what we are doing in India. Basically, uh, we ask the patient to come visit, and we start the treatment on urgent basis because of the fear that might lose that patient. In foreign countries, basically, they try to communicate with the patient, give more time with the patient initially for the consent and all the communication or whatever the problem patient has. So basically, this time, what you have given to the patient previously in the pre-operative time, that might reduce your complications afterwards. So better you have to give a procedure, you have to give the detailed procedure, risk involved, complications, and prognosis of that particular procedure. You have to return, you have to write in that particular consent and get the sign of the patient. Okay, take all the precautions and do as per the protocol. Now, one case has been viral on the WhatsApp. Some unsterilized instruments like this will causes some brain issue. So you have to follow, as you know, we have learned from our schools, dental schools, that we have to sterilize the process. We don't have to tell that. We always do that. But certain times you might forget certain things because if you don't know what your assistant is doing about the sterilization, you have to keep in watch on the particular protocol, and you have to make sure that your sterilization is up to the standards of the whatever given by the profession. Take the fresh consent for every new procedure. Now, whenever you have decided a particular procedure like root canal, and at the end you find that there is a percussion involvement and there is a poor prognosis for the particular tooth. So you think of extraction, and patient is convinced for the extraction. Then take the consent for the extraction again, because what you have taken the consent for root canal and you have not taken the consent for the extraction. In future, patient might tell you have taken the consent for the root canal, not the extraction, and he might fight in the court for the particular thing. Develop the communication skill. Develop the communication skill in the sense you have to explain each and every aspect of the treatment, prognosis, diagnosis, everything you have to tell, but don't be over friendly with the patient. As you know, the patients nowadays are very vigilant. They know more than you. Basically, they know dentistry as well as law more than you. Keep in mind, they are very much aware of the what the treatment is going to be done by you previously on the net. Okay, so don't keep them in a shadow. A case two, in your clinic, a 22-year-old male patient visited after 3 years of orthodontic treatment. Now, orthodontic treatment has been done 3 years back. Okay, and now the patient has complained of relapse. Okay, now because of the relapse, he demanded a money which is threatened you about the filing of the negligent case. Okay, now what issue has to be addressed in the particular case? First, whether informed consent has been taken or no. Second, similar what we have discussed in the previous cases, like this is somewhat different, like the procedure has been explained to the patient. So complications such as flaring of the or relapse of the case, it has to be explained in the patient, and a post-operative care has to be explained to the patient in the written manner. Okay, the patient was given a chance to choose a particular treatment. If you are thinking of the ortho case, then whether you have given a removable appliance, where you have told him that it can be treated with a removable fix or the aligners. Okay, so whether you have given any choice or you have directly told him that you can treat it with the aligner or you fix treatment. Okay, then you have to check with the records whether it is a cephalogram, whether it is a OPG, it is a photograph, radiograph, all the forms and footage, CCTV footage. Then incidents and reasons of relapse. As you know, it can be well-known fact that if the post-operative care has not been followed, the patient has not worn the appliance post-operatively, then the chances of relapse are more. Okay. Then any expert opinion of the orthodontist or any negligence which is caused by the patient, as the appliance is not being wear by the patient. Okay. So the negligence is also from the patient side. It is called as contributing negligence. Okay. You have forgotten to tell the patient that you have to wear that particular thing for the particular period, and similarly, at the same time, the patient has not worn that appliance. That is called as contributory negligence. Now, how this case will be treated? Similarly, you have to ask the consent, post-operative data, all the evidences what you require for the presentation of the case are required. Okay. Then, manner and duration of the usage of the retentive appliance, whether it has been explained to the patient in the written manner or no, any written record has been taken from the patient or no, any contributory negligence has been evidenced by you, and any grounds of negligence, that is mens rea, that is the guilty mind. It is basically a criminal law. We do not discuss this in this session. The standard of care, because as I told you, standard of care and what protocol you have to follow. Standard of care means what a person, a eligible person can follow the particular protocol in the particular case. That is called a standard of care. Up to the negligent act, whether you are acting, you have to act something according to the law, but you have not acted, or this is called an omission. And nexus of the damage, what particular thing has to be done, one particular action has to be done by the dentist, but he has not done. And this causes the damage to the patient. This is called a nexus of the damage. That is the relation of the damage to the particular thing. Then what is the duty of take care and standard of care? Basically, duty of take care and standard of care, it is for us doctor. Okay. Now, by the profession, we are obliged to have a proper take care of the patient and avoid injury, harm to the patient. Okay. If you don't know anything, we don't do anything. If you don't know how to do good, don't do anything. Cause no harm. This is the principle of the ethics. Okay. Standard of care is what? It is the degree of the prudence or the caution. Whatever prudence means and caution means what a particular procedure has to be followed in a particular way. Okay. And if the profession and professional has been followed, then it is called as standard of care. Now, any doctor does not require above average skill. Law says that the particular doctor or the particular professional requires average amount of skill or average amount of the knowledge for that profession to carry out. Okay. So everybody need not to go with the highest skill or the highest of knowledge. Okay. But they should know the basics of the knowledge and they should have follow the standard of care. Now, this is the basic principle of the law, that is res ispa loquitur. Now, this particular Latin maxim is called is basically uh, basically tells that the thing speaks for itself. Means what? If anything, I will tell the example of root canal file, broken file in the root canal. Okay. Now, broken file in the root canal. Okay. You cannot, if you cannot remove that file is going to be visible on the radiograph. Okay. That file, which is particularly seen on the radiograph, it itself told that my root canal has been started with the dentist and it has been broke in the root canal. The reasons will not be told, but the things that the file will itself told that root canal has been started by the dentist. Okay. Now, in this case, now is case of determining the negligence. Okay. Now, file blockage, breaking of the file is a well-known fact. Okay. So it is cannot be called as a negligence, basically. Okay. But in this case, if you see the radiograph of this particular patient of the abdominal radiograph, there is an instrument left in the stomach during the surgery. This is called as gross negligence. This forceps should not be there after the surgery. Okay, so gauze piece in the apicectomy or appendectomy, which has been there. So gauze piece should not be there. Okay. So whatever the particular thing or the particular instrument or the our surgical material should not be there, which should not be there, it has to be removed. And if it is seen on the radiograph or it is seen on the part of the surgery during the surgery, then it is considered a negligence. Now, this is the aspiration or injection of the dental instrument by the patient. Now, this fight itself told that my root canal has been started and accidentally I have gone to the alimentary canal or the nasal passage. Okay. Then how to settle? Now, how to settle this matter? This particular orthodontic case, don't be panic, don't pay the money directly. Okay. Now you still know you can do the corrections after this. So discuss this matter with your orthodontist. If you think it is your fault and patient is nagging, okay, then try to solve this on your part by orthodontist. Let your pocket be spend the money, but don't take that patient again and again. Okay, refusely polite that patient. Do not retain that patient henceforth, because you know once the patient is been doing that, then again he will cause the relapse because he is not going to follow, because you found out that there is a contributory negligence from that patient. Okay, then compare the amount of time you spend with the case and refund and no time spent. If you think that completion of this case after the relapse takes less time than negotiating that case in the court, the better go in the clinics, not in the court. Okay. Claim for the negligence. You can claim for the negligence that is contributing negligence. So at least your claim would be settled at the lower amount. Now remember, sometimes taking one step back is not your defeat, okay, but it is a major step to save your future, basically. Okay, so I have given the money back to the patient, so it is causing my ego hurt. My ego is hurt. I don't want to give the money. Let it be. One patient will not affect your practice, but that one patient causing the negligence case will affect your practice. So better not to go into the details of the legal matters. Better to try to solve this case at your level. Okay. Then facts of the negligence scenario in India. Now these are the various cases where the dental mirror or the scissor has been went into the lungs in the alimentary canal, and this is the X-ray. Then this is the data which I have got from this article, Thauraja. He has gathered all the data from the consumer protection forums, and this shown that the majority of the specialties which have been compensated are: first is surgical, that is oral surgery, then conservative, that is broken bridges. He has given, you can read this article, which is very nice article. You can have the look where people are going wrong or where the cases of negligence are going. Okay, so you can have this article. Then what he concluded in this total gathering of this article, out of 111 cases, 67 cases were decided in favor of the dentist. Means what? There is little hope for the patient and more chances for the dentist to win the cases. But the figure which is there, that is 44. 44 is also big figure according to 111. So 39, the 40% of the cases, dentists were in the defeat, that means dentist has to pay the claim. Okay, so in the cases you have to take care of yourself. If you know the law, you can take care of this yourself. Okay, now this particularly you can see the 33%. It is because of the extraction wrong cases. It is related to extraction cases. Next, it is decided 21% it is root canal treatment. So these are the very common procedures in the dentistry, as you know. And these are the cases where the patient gets the maximum benefit from the code. Okay. Now, what you have to think, what these cases might show. Basically, you need to understand. First thing, you are no more God. Previously, you were considered as a doctor was considered as a God, but nowadays The God is God and dentist is a person or the person other than the layman, but only that. The God, there is no comparison of God with the now doctor. Okay, so you know, need to understand this. Keep patient, consider themselves as a consumer and then you as a service provider. Okay, then you should know the treatment and be vigilant and proactive. You should take the standard of care. Then no need to recall the importance of documentation and record, because if any negligent case has come into the court, you should have with the proper records and documents of that particular case. Okay, and patient might use a political power. This keep in mind, because this is very common practice nowadays. They threaten you on the phone through the social media or political power. Now social media are very proactive. Okay, people don't know the facts, but they follow the particular thing, and it may cause your bad mouthing or the reputation. Your marriage will be tarnished. Okay. Now, what you need to understand, you need to have good relationship with your colleagues, that is your fellow colleagues, dentists, medical practitioners, politicians, police, as well as social activists. These are the people who can help you in the cases of managing your negligent cases, or they can manage you from the stress that been caused by the negligent case. Okay. Now you need to update your knowledge, legal awareness regarding our profession, law of land. See, basically, we think that we dentists or we professional think that knowledge of the particular field, that is our dentistry, is basically enough for me to practice the dentistry. But it is not. Keep in mind, the knowledge of dentistry or knowledge of medicine not enough to practice a dentistry or the medicine profession. You should have a legal knowledge. Then only you can proceed with the good practice. Okay. Now we'll move on to the major causes of the cases. What is the major cause? Why the cases have been there against negligence? First is that unsatisfactory communication. This is the major cause which I have come across by solving through majority of the cases. Okay. So various cases have been lodged in the dental council or in the local bodies. Okay, or the people have come to us, this is the problem with the dentist. So basic problem what we have found, that there is a lack of communication with the patient. The patient's ego was hurt. Okay, if you try to convince the patient politely, okay, the majority of the problems will not arise. Okay. So first is that unsatisfactory communication. You have to keep in mind, you have to speak very politely, okay, with the patient. Now, second cause of this unsatisfactory treatment. The patient is complaining, complaining of the pain, or he is not happy with the good looks. What these are the various causes. Then wrong treatment done by you. The patient has come for the 4 and you have treated 5. Okay, that's the wrong treatment. Dental jousting. Now, this is a bad mouthing which is done by our professionals. Okay, greedy patient. Now, some people, these are they make their profession as a, they see us as a white collar. Okay, so white collar people are very easy prey for them to extract money from. Okay, so these are the people. Be away from these people. Then rivalry basically from the colleagues, from the relatives, or from the various people who are around you basically. Then you should know the important laws related to our profession. See, these are the laws, but at least you should know the basic some sections of these laws. First is the Indian Dentist Act, then Consumer Protection Act. Now it has been repealed in 2019. Now Dentist Code of Ethics 1976, then Indian Medical Council 2002 it has been repealed, then Indian Penal Code, then Criminal Procedure Code. These are the laws which governs our profession basically. Okay, you need not to know each and every section of this, but at least some sections or some particular part of this sections you should know. Consumer Protection Act you should know. Okay, why to learn this dental legal aspect? What is the purpose of this lecture today? Is to save the dentist from attempting any negligent act. Now, sometimes you don't know this act is considered as a negligent in the court. Okay, so you should know which act can be considered as a negligence in the court of law. Okay, now this will save from you false and frivolous negligence allegation. Now the people are extracting money and they are ready. Okay, so they might they might allege you that with the bad treatment or the unsatisfactory treatment. Okay, now this presentation is for to save your time, money, and generate some confidence to tackle such cases when some case has been pressed upon you. Okay, so don't be panic. We are there to help you. Don't worry. Okay, for professionals and personal safety. Professional safety is that once the image is tarnished, it is very difficult to get that image again. You know that. And personal safety, basically, dentist is by God grace, dentist is very lucky कि अपने को assault और ये सब चीजें नहीं देखनी पड़ती. But yes, dentistry, not dentistry, but medicine. People, doctors have been harassed and molested by the people, by the patients actually. Now, to save the name and reputation in the society. So this basically lecture, I will give you a brief about what you have to do and what you don't have to do. Okay. Then consent. Now consent is no everybody. I think everybody has been taken a consent, and everybody is taking the consent in their capacity. Okay. So what is consent basically? Consent is not a medical term. Basically, it is come from the Contract Act, and it is what the when two people give the permission to the particular act in the particular sense, then it is called as consent. Okay. In layman terms, to give the permission for the specific purpose of the act, but in medical intent, to give the permission for examination, investigation, and the treatment. Okay. Now, in contract act, it has been given that when the two persons agree on the same thing, on the same sense. Okay. Now, what is valid consent? The consent which is given by the person who is above 18 years, of a sound mind, which has not been taken by the coercion, fraud, undue influence, or misrepresentation, or by mistake, it is called as valid consent. Any consent which has been taken for the person who is below 12 years or below 18 years, it will not be considered as a consent according to Indian Contract Act. Okay, so the person, if it is minor, that is called as assent, and you have to take the consent of the guardian or the person who is accompanying that person, patient. Okay, then when to take the consent? You should not take the consent during the procedure or in between the procedure or after the procedure. You have to take the consent before, well before each investigation, therapeutic or surgical procedure. If you plan to change the treatment, then you can take the fresh consent for that particular procedure. Okay, if I'm planning to do the root canal at a certain time, I'm planning to go for the extraction for the particular teeth because of the poor prognosis, I will take the extraction consent again. Okay, then obtaining a consent. Consent, when has to be consent to be obtained? What consent contents of the consent should be there? First is the consent should be obtained before initiating any treatment. Signature of the patient and the relative has to be there on the patient on the consent. Then patient if 12 to 17 years, that is called an assent. The patient signature and the relative signature should be there. The consent should not be altered once it is taken, signed by the dentist and the patient. Okay. Then perform only those procedures for which the patient has been consented for. पेशेंट ने अगर कंसेंट लिया है दिया है आरसीटी के लिए डोंट एक्सपेक्ट द टूल्स फॉर विद दैट कंसेंट okay you have to take the fresh consent. Okay, now language of the consent. Now see, I saw people who are making very complicated language so that it will not be understood by the patient. Okay, so keep in mind, too complicated language, too many complications. Okay, if your consent is very easy to understand, okay, it can be easily signed and will not be questioned in the court of law. If you have to use a very distinctive medical terms or legal terms, then patient might not understand that, but he might sign. Okay, and patient in the court of law will tell that I may not understand this because it is very complicated. So basically, keep it in the local language and keep it very simple. Okay, clearly mention what you want to tell. Okay, then when the consent is not required, basically, first is a medical emergency. When it is a life-threatening emergency like cardiac arrest, or the medical emergencies which have been taught in our syllabus, then dentist should not wait for the consent. He has to start the treatment promptly. Okay, start the emergency to save the life of the patient, and upon the court order for the oral and dental examination of the prisoner, or in the medical legal case, do not need the consent. You need only the order of the court. Okay, now what the contents of the consent में क्या होना चाहिए? First, 5 basic information, that is demographic information of the patient, name, age, जो आप लिखते हैं, drug allergy, whatever the case history format is there, you have to follow that. Then, what is the problem? That is chief complaint. Then you should write the diagnosis with its severity. What are the different treatment options available? Like if it is a RCT treatment, then go with the RCT extraction, whatever implant, whatever the treatment options which are available with that particular thing. Then required, how many settings are required? What are the options you have given and what option patient has chosen? Then statement of right to choose means what? You have to make a statement that these treatment options has been given to the patient and the patient has choose this treatment option for the treatment. Okay. Then anticipated and known complications, which you know, if eye might broke, the tooth might broke during the extraction. These are the complications which are known by you. You have to mention these particular known complications. The need for the treatment and future need for the treatment. What? Because why you are treating that disease, and if the disease has not been treated, what will happen? You have to mention in that. The need for the post-encore, you have to write need for post-encore. You cannot tell the patient to do the RCT and go. No, if it is needed for the post-encore or the crown, you have to mention that. Okay, the signature of the patient and the doctor. Then one case has been will be there. Okay, there are many slides, but I will just this case one I will particularly tell you. The patient in particular hospital has come drunken, reported with a drunken state, and asked the patient will ask the dentist to do the root canal. Okay, doctor is knowing that he is drunk. Okay, then still that doctor has started the treatment. One file has been gone to the patient's mouth, and it is into the dentist has taken the care after the file has been gone into the stomach, but he has rushed the patient to the hospital. Okay, but what he has taken everything, every precautionary action. But what the judgment says, when you know the patient is of the unsound mind, under the influence of the alcohol, why you have treated that patient? So who is negligent now? The doctor is negligent in the particular case. If any such situation occurs at your clinic, don't entertain the patient in the particular appointment. Okay, let the patient go. He should be in the proper sound mind. Okay, then Ishwar Das Gupta, Ishwar Das versus Vicky Gupta. Patient suffers from the soreness and ulcer due to the improper fitting, and the dentist was held liable. In this, patient was approached the dentist and he has not entertained the patient, so that the aggrieved patient hurted, and he has not referred the patient, the dentist not referred the patient to the specialist. So basically, the not referring the patient in a particular time is also considered a negligence. Okay, I will just move ahead. Okay, record keeping. Less evidence is poor defense. You should have a proper no evidence is no defense in the court of law. So keep in mind, whenever there is no evidence, there is no defense. Okay. Now record keeping. What should you have? The case history form, prescription, dental radiograph, photographs, informed consent, written verbal communication, and CCTV footage with voice recording. This is very important, particularly in the cases where female patient has alleged a dentist about the molestation. Okay, so CCTV footage, every clinic should have CCTV footage with on voice record facility. Hello.
આપણે એટલા બધા વાસણ નહીં આપતા એમને કરવા માટે અને મેં તને કાચના વાસણ છો તું ઘસતી પેલા સાદા વાસણ મૂકવાનું
Somebody is
એનો
interrupting
લાભ
those.
નહીં લેવાનો આપણે વાસણ બે ટાઈમના બંધાયા છે બે
Yes,
ટાઈમના
sir,
વાસણ
yes,
એક
sir.
ટાઈમના
I'm just
જેટલા
checking.
નહીં થતા હોતા એમને પૂછજે બીજા ઘરે કામ કરે કેટલા વાસણ હોય
Just a minute, sir.
તું પણ દરેક તું પણ તું પણ દરેક બાબતમાં નહીં કરતી મારી જોડે રકઝક મેં ખાલી એટલું કીધું વાસણ મૂકી દે ના ઘસી
Ask them to mute the voice.
Yes, sir. Now, till that, everyone is on
Yes.
mute, sir, but I'm not able to. Everyone is there on mute.
Somebody's phone is still.
Rajesh, yeah, Rajesh, it was. Yeah. Sorry, sir. Sorry. Now it is done.
Done? Okay.
Yeah, yeah. Please go ahead, sir. Sorry.
So record keeping is basically what you have to. I have told you what kind of record you have to keep. Then record preservation. There is a called act called as Limitation Act. According to that act, every evidence has to be preserved up to 3 years. Okay, so that this is also given in the INC regulation 2002 that you have to keep the record, medical record, a prescription copy for at least 3 years. Okay, and if the case is pending in the court of law, it has to be preserved till the court has decided that case. Okay, and if any court of law has asked you the evidence, you have to furnish that evidence within 72 hours. Okay, then comes the Consumer Protection Act. Now, these are the 1960, 86 and 2019. Some changes are there, like they have increased the compensation. Then there is a provision for the mediation. You can legally you can go for a mediator. Then imprisonment for the has been increased from 1 year to 3 years. Okay, and fine is also increased. Okay, now consumer forum where the patient can file a complaint. Now, patient can file a complaint where he resides, where he works, where the dentist clinic is there, or where the dentist resides. So, patient has the option to file the complaint at any place. Okay. Now, how the patient can file the complaint? On the net also he can file the complaint. Now on the click, basically, first he can give the written application to the consumer forum office, online e-filing he can do, mail to the registry, attaching the proofs and paying the requisite fees are also very nominal, 10 to 100 rupees it is depending upon the case, and there is no need of advocate actually to file a complaint. Okay. Now, what is the specific time limit when the patient can file the complaint? First, within the 2 years. Now, again, Meenakshi Maurya.
नाम उसका ना ब्रैकेट में लिख दो
Voice is on. Meenakshi Maurya.
Yes, sir. Again, I'm checking. Meenakshi, yeah. Done, sir. Go ahead.
Yes. Okay. Now, what is the time limit for according to CPA? Within 2 years from the date of treatment or within the 2 years of deficiency found by the patient. Okay, so 2 years not from the treatment, but when he found there is a deficiency and he got to know that I have some problem with the particular treatment, he can file that case within 2 years. Okay, the total period of filing is usually 3 to 5 months and depending upon 6 to 10 months depending upon the requirement of the records. Okay, then who has to prove the negligence? Basically, when a patient files a complaint, the patient has to prove that the doctor is at the negligence. But when there is a prima facie negligence, that is, there is a file or there is some particular instrument in the patient's mouth or patient's abdomen, then there is a prima facie evidence. Then doctor has to prove that he is not negligent. Okay, then these are the appeals where you can do the appeal with the higher commission, that is state commission, national commission. Okay, then amount when your appeal not been heard by the lower court, you can go with the higher court. But whatever the amount of the compensation has been allotted by the lower court, 50% you have to deposit to the higher court. Okay, if 6 lakhs is given by the lower court, you have to deposit 3 lakhs in the court, higher court, and then only you can proceed with the appeal. Okay, now what are the general mishaps in the negligence in the dentistry? Failure to diagnose. Okay, oral cancer basically in the early condition, if you fail to diagnose, this is called as negligence. Failure to take the preoperative radiograph. So that's why I am telling you, I am advising you to take the preoperative radiograph for every case. Okay, if you don't know the case, how can you proceed? You refer that case to the particular specialist. It is also, if you are not referring that case, it is also considered the negligence. Then failure to prescribe antibiotic prophylaxis, particularly in the cases where rheumatic arthritis, you know the patient is on the particular rheumatic disease. Okay. Then instrument or the tooth or a foreign body or aspiration or injection. As I said, a file or the tooth has been ingested or inhaled. Okay. I will go ahead with it. When the dentist is responsible or when the dentist is considered a negligent. First, law considered certain acts as a negligence. First, when the dentist failed to accomplish the duty of care. Okay. Second, when there is mens rea, means there is a guilty mind. This is usually in the considered as a in the criminal cases. Second, there should be a direct relation of your act and that damage by the damage to the patient. Okay, and damage should be closely related. That means thing speaks for itself. Res speaks for locutor. That maxim is to be followed in the cases. Okay, when the dentist is not liable, first patient did not disclose the correct or complete information. Patient hides some information. You see, example, patient is on the eco screen. Okay, and patient has not told you, and you have extracted, and patient has been hospitalized, and again filed a case against you. So you have a record that patient has not been disclosed any information. So we don't know the information. You can have your way to sort out this case. Okay, following specific accepted treatment, but not getting the desired relief. Now, in certain cases, after treating the patient and the following the protocol, the patient may not have the relief. So this is not your negligence. Okay, this is considered the procedural part. Patient did not follow the post-operative instructions and missed recall visit. So whenever you are giving a particular appointment to the patient and your visit is over, you have to mention in your paper that patient next visit is when you have to keep the written record of that particular thing. Okay, the patient accused the dentist is overcharged. Charging is depending upon the patient, depending upon the dentist. So patient cannot claim that this dentist is charging more than the other dentist. It is up to you what charges you have to take. Okay, free of charge treatment when the dentist is doing is not liable. Okay, therapeutic privilege. One thing is there. You have a privilege that you should keep some information with you only, and you can disclose that information not to the patient but to the relative. Okay, example: a patient is admitted. Okay, patient is admitted for the severe coronary or artery disease and just had a heart attack. But grade 3 cancer is also there detected during the investigation. So doctor does not tell the patient directly that he has also cancer also. Okay, because we have to save the patient's life. So he told that he revealed the information not to the patient but to the relatives. Okay, it is called a therapeutic privilege. Now indemnity insurance. Indemnity means what? I am giving you simple example. Like for a ball is playing on the ground and he's broken the glass. Okay, so father is indemnified. The patient, the student is indemnified by the his father because everybody knows that his father will going to replace that particular glass. Okay, so indemnity means what? A particular person is sure that if he has followed, he failed to follow the particular thing and he is at the negligence, the other party will pay the compensation on his behalf. Okay, like a third party insurance. Okay, okay, when there is an accident, the third party insurance, if it is there, the insurance company will pay for the damages. Okay, is the Indian need to indemnify basically. Now, if you think accident is rare, so that rare can come at any time. Okay, so basically accident is unexpected and it can come at any time, any one. So basically we have to prepare. Okay, when you are preparing your when you are insuring your car, your clinical practice from which you are earning that should be indemnified. Okay, so what indemnity do? It covers your financial losses if it is done in the negligent cases. Then insurance companies have a tie-up. What is the advantage of insurance company? They have big firm, big setup. Okay, they can have their what you tie up with the lawyers and very specialist of the hospitals, so they can manage the cases well enough on your behalf. So better to have insurance. Okay. Then factors to be considered while choosing the dental indemnity insurance. Okay. First is what? Now, how you choose the insurance for your car is that reputation of the particular company. Then amount of the premium to be paid. Like the premium should be low and the benefits should be more. Then past claim settlement ratio. Usually, when you take the insurance for the car, we usually see this. Then time period for the insurance settlement claims. In how much time that insurance claim has been settled, it is also usually we see. The flexibility of the time, it is usually 7 to 15 days for every insurance company to pay the compensation. Then factors to be considered while choosing the dental indemnity. Now, these are the factors are customized for the individual dentist. Okay, the members of the clinic who are covered. First is the dentist and staff. Okay, because the mishap can happen from the staff also or your locum also. Okay, so better to indemnify both the dentist and the staff. Okay, then how much are you are practicing area practice, then amount kitna deduct hoga, some amount has to be deducted from this, then lawyer fees is included or you have to bear the lawyer fees, then policy terms and conditions you have to read, then inclusion exclusion criteria of the policy you have to read. Okay, because inclusion and exclusion criteria are very much critical for your insurance to pass. Okay, so what are the digital indemnity policy covers? First is the extent of financial damage or loss of cost to the victim. Then against the unintentional errors or omission, if जैसे hospital break हो गया, is any property damage to you or any damage to you or your family, they've been covered. Then cost of your court fees as well as the lawyer fees, then it usually covers 1 year. Okay, any indemnity insurance like a car insurance, it covers usually 1 year, but you can have a plan for the 5 years, 3 years, 5 years, or 10 years. Okay, but any insurance company will not cover any unlawful act or criminal act, fraud or penalties. Okay, keep in mind. If you are taking this for any unlawful things, then it will not take care of. Okay, how much amount has to be insured by the particular? This depends upon your practice. Usually, what we say it should range from the 5 to 15 lakhs. Okay, for my practice or what I'm the government, still my wife has a clinic, so we have taken a 50 lakhs indemnity insurance. So basically, according after Corona, everybody has taken the insurance. I think so about their life insurance. So take the indemnity insurance, that will help you a lot. These are the some indemnity insurance companies which are there in the market, like New India Assurance, then ICICI Lombard. There are 2 or 3 companies which are providing the indemnity, such as Apex Company and Dr. Risk. These are the companies which provide you the lawyer support and any other support which we require in such cases. In cases of emergency, they will provide. Okay, how legal hassles, get up to date. Your knowledge should be updated. Then proper documentation. As I said, every clinic should have the audio visual CCTV running. Okay, only CCTV is running, but it is not been updated. It should not be case there. Okay, take a legal help whenever is required. Take a legal help because you don't be a doctor of yourself. Okay, and take the indemnity insurance. Okay, what do you do after negligence? If the negligence is happened, okay, what you will do? Don't be panic. First thing, don't be panic. Don't flee from the situation. If you flee from the situation, patient will take the advantage of that particular situation. Okay, frequent check on the patient's condition. Okay, if you follow up the patient regularly and if you continue following it, the patient might not take the step which causes up to that police complaint, or that step will not be taken by the patient. Okay, try to manage the emergency. If the file is escalated, try to shift the patient as soon as possible to the emergency. Okay, to try to manage the emergency, get of the expert. They're like colleagues, your medical professionals who are your best friend. Take the help of them. Shift the patient to the higher center. If it is required, go to the higher hospitals. Okay. Keep track of the chain of events. You have to keep the event in the chronological manner. Okay. If not, the CCTV will help you after the situation is normalized. Okay. Keep the regular follow up of the patient. What information to be disclosed to the patient? First, broken instrument. Okay, you manage the things, how you have to express yourself or how you have to tell the patient, it's up to you. Okay, block canal. Always tell the block canal, missed canal, negotiated canal, apical third root fracture during extraction, luxation of the other two during extraction. These things you can tell the patient at your level, and how you are telling that in this you have to learn. Okay, then when to tell and when not to tell. First, better to disclose all the things. Okay, happen during the procedure to the patient or the relative, depending upon how you communicate with the patient. If the patient is conscious, too much conscious, okay, and physically, mentally not strong, then don't disclose that immediately. Okay, so it is better to tell the patient, or the patient will tell you next time after he goes to the other dentist, and the other dentist will tell him, and that patient will again come to you and tell that doctor, you have not told me that the file has been broken in this particular case. Okay, so better you tell him rather than other dentist told him. Okay, now how to reveal the mishap? Keep your calm. Don't show any expression on your face if the file is broken, basically. Okay, or the root is broken. Don't show anything on your face. Don't get disturbed or show in your face. mentally train yourself in for such situation. Okay, inform the patient about the complexity of the situation. Reveal the language best understood by the patient, not in the dentistry language or not in the medical field language. Okay, inform about the prognosis, and if the patient is convinced, if the file is broken, patient is convinced for the extraction, go with the extraction immediately. Okay, if the prognosis is poor. Okay, and if the tooth can be saved and can be referred to the specialist, better to refer it to the specialist. Okay, can dentist be arrested for the mishap or negligence? Basically, no. Strict no. Okay, when there is a prima facie evidence, when he can be arrested, in the prima facie evidence that the jaw is broken, okay, during the extraction, where the chances of tampering of some evidences or chances of dentist can go and flee, so dentist can be arrested, depending upon the situation. But usually, doctors are not been arrested unless and until there is a criminal charge. Okay. After, what do you do after legal notice? If any patient has sent you a legal notice, what you will do? First, go to your expert in the field. Okay, colleagues. Okay, approach your indemnity insurer. First, tell the insurer, by some situation happened and you have to intervene. Okay, approach your lawyer if it has not been covered in your indemnity insurance. Don't try to alter or tamper any record, because you don't know which record might help you and which record might destroy you. Okay. Then be precise with your answer. Whatever answer you have to give in writing or in orally, be precise about that particular answer. And you have 30 days to reply the answer to the court. So better to take the opinion, then only write answer. Take the help of the lawyer and the insurer. Try to know what you have to know. Try to know the patient's objective regarding the complaint. After he complains, what is the purpose of this complaint? First, either he wants refund of the money, okay, either he wants good treatment from you, or he needs compensation, or he is mentally prepared to tarnish your image. Okay, to try to find out the motto, what the motto is there basically. Okay, so first is a genuine reason, that is we are at the fault. Okay, revenge maybe he might his ego must be hurt. The apology is expected from the patient. Conspiracy maybe. Okay, the reason behind this, first is try to know the reason. Patient is not getting satisfactory treatment. First is that our treatment might be at the problem. Then unexpected communication or not expectable communication, that is the ego of the patient is hurting. Then rivalry by the other dentists are instigating the patient, go and do such things anyway. Then some backstage support like politician, police, antisocial elements are there. So try to find out such things. Okay. Then prepare with, when you have to fight with such case. Okay. What you have to be with, you have to mentally prepare and write down the chronology. Okay. Chronology means when the patient has come to you, when are the visits, what are the visits, then what treatment you have done, what precautions you have given, everything you have to chronologize. Okay. Then patient's history, everything, every record has to be there. Then sign consent form, CCTV footage, if it is possible, try to retrieve. So it is basically to have a good server in your clinic. Then opinion of the expert, then literature search. When you, if your literature should support your claim, then active indemnity policy should be there. Now, all the things have been done, and still you have to fight the case. So, what patient will think, and what defensive ground you can opt? First is the patient negligence. That you can prove that the patient is negligent on his part. Okay. So basically, example, patient with history of cardiac blockage and aspirin. Okay. And we told the patient that don't take the aspirin 3 days and 2 days after post extraction. But patient has taken the aspirin and there is a continuous blood flow. So who is at the negligence? Patient is at the negligence, because we have already instructed, or the cardiologist already instructed not to take the medicines. Okay. Then other contributing negligence, as I said in the case of ortho, the patient has not worn the plate. The contributing negligence can be same. Therapeutic misadventure. Okay. Accident or mishap. Okay. Patient should know sensitivity to test dose. You have taken, you have given a test dose to the lignocaine, but later on the patient has developed a sensitivity to lignocaine. So basically, it is mischance or a misadventure, you can say. So there is a defensive ground that we have given taken a precaution, but unfortunately, this reaction happened. Okay. Defensive ground, no duty. Now patient has been treated for the particular teeth and the patient is complaining of the other teeth. Okay, so there is no duty of you to that particular tooth because we have completed your treatment for the particular tooth and patient is now complaining of the pain in the other teeth. Okay, so your duty is over with that particular tooth. Okay, no nexus between the act and the damage. Okay, now example is that patient is treated for the pain in the mandibular left first molar with the root canal. Okay, so patient cannot blame you for the pain in the upper tooth. Okay, so this is called a don't. There is no nexus. Okay, now duty discharge according to standard. Whatever the standards are given by the or profession you have followed, that is sterilization, post-operative protocol, everything you have followed. Okay, standardization treatment protocol is followed. You have to prove it. Okay, then defensive ground, error of judgment. Now, error of judgment would not amount to the negligence. Okay. Now, there is a case, very famous case, there was in Muthali, case where a doctor diagnosed the patient with influenza, but fact that the patient is suffered from the meningitis. Now, this case is very old. Nowadays, there are lots of investigation can be done to arrive at a particular diagnosis. Still, you are confused. You can write on the paper that differential diagnosis you can write is suspecting, or you can write suspecting of this diagnosis. But if you are suspecting any particular disease along with the disease you have mentioned, so write it on the paper. Okay. Then therapeutic privilege, res judicata. Res judicata is that for a particular thing, you once it has been decided by the one court, a matter is already all you have been already told that the compensation has to be given to the patient by the one court. The patient cannot go to the other court to get the compensation again for that particular thing. Okay, that is called as res judicata. That is same thing cannot be compared. Okay. Then what information need to be disclosed to the patient? As I told last time, root piece, broken instrument, block canal, missed canal, everything. Then when okay, how to reveal mishap? As I told you. Then this is a specimen copy. You can have the photo copy of this screenshot. Okay, this is a particular thing where you have to get the consent for the particular procedure, and you can modify, customize according to your needs and your practice. Okay. Now, important tips from my side, that is soft and sympathetic talk. Good communication in the clinic room may save your time in a courtroom. See, patient might, majority of the cases, what we see in our practice is the lack of communication or a bad communication, basically. So have a good communication. If you are not good at the communication, try to give the chance to the other people who are good at the communication. Okay, your assistant might be good at the communication, so try to resolve the problem through the good communication. Okay, keep the record documentation. Always for a particular male doctors, I'm telling you, keep one lady assistant or dental associate while consulting or treating a lady patient. This is a law. This is a case where one patient cannot blame that some molestation has been done. And if you don't have any proof to prove it, so it is very difficult in the court of law to prove yourself as an innocent person. Okay. So basically, you should have one lady assistant and a CCTV footage. Okay. Whenever possible, don't change the treatment plan. As it is my general opinion that you don't change the treatment plan. And if you want to change the treatment plan, go with the another consent. For that, change in the treatment plan within advice. Okay, good communication, as I said. Then avoid sentimental and reactional overflow. File is broken, don't show it on your face. It breaks. Okay, so don't show on your face. See, the patient sees at your face, and if he catches that reaction, okay, so he might be suspected that something has happened back to me. Okay, so don't show or don't overreact basically. Okay, then don't check the patient before without proper attire and proper safety protocol. Don't check the patient with bare hands. Okay, or don't check the patient without proper instruments. Okay, then try to reduce the patient's anxiety, because these patients usually, if you try to do anything, they will repercussion. It will give a repercussion on your practice. Okay, then don't force the patient for any treatment. Basically, particularly children. Okay, don't force any treatment. Okay, if anything happens bad to the patient in that particular situation, then it will all blame will be on the dentist, not on the patient. Okay, don't try to alter or tamper the records. Once it is written, don't overwrite, don't change the pen. What I suggest is that your consent form should be filled in one particular pen, one ink only. and your consent signed also in one ink only. Okay. Then avoid such terms. What we are giving, मैं हूं ना, कुछ भी नहीं होगा, बहुत चलेगा, don't worry, lifetime guarantee, warranty. Avoid such things in your practice because these are the things where the problem arises. कुछ नहीं होगा and lifetime guarantee. There is no guarantee for our life. Okay, how can you give the lifetime guarantee to that particular thing? Okay, so basically, don't give any warranty guarantee. If you want to make some crowns or prosthesis and that has a guarantee, so don't tell that patient that this is guarantee or warranty. As the patient, this is very good, this will last more than this will more this. Don't tell guarantee warranty. Now majority of the people are selling this product with the guarantee 5 years warranty, 10 years warranty, 15 years warranty. This is a bad practice which they are carrying out. Okay, the important tips is never badmouth against the other dentist. Never instigate the patient with against the dental treatment of the other dentist. This is very common, which has been observed in our faculty. Okay, then tell it is common when the patient comes to you, it is common. Okay, file blockage. If you see on the radiograph, tell that it is very common and it can hide with me also as a specialist. Also, I might break a file. Okay, when you're feasible, send the patient to the dentist for their opinion or previous dentist for their opinion whenever possible. Okay, if you don't want to lose the patient, you can keep the patient, but don't joust against that dentist. Okay, keep in mind today it's him, tomorrow it's you. Okay. Then this is the situation of our dentist. Okay, dentist behavior with each other, smile on the face and gums in the hand. घर का भेदी लंका है. Okay, as you know, Ramayana. Okay, what keep in mind? What you have to do? You have to follow this protocol. Good communication. Implied consent is not valid. Implied consent means what? When the patient comes to your clinic and sits and he asks to check you, that is called implied consent. The patient is showing through his action. Okay, but implied consent is not being valid in the court. Explain the patient about the post-operative complication in prior in written matter. Okay, what is deep pocket theory? Deep pocket theory means what? If any accident occurs with the cycle and a car, so everybody will see that, will think that that car wala person has a problem and he has dash onto the cycle. Okay, but actually the car is on its regular way and cycle is crossing the way. Okay, so deep pocket theory always that let the affording should pay. So deep pocket theory is usually applied to us because the people think the dentist is very rich. Okay, the doctors are vulnerable because we are white collar people and we don't know anything. They are the easy prey to get the money, extract the money. So basically, attend the emergency whenever it is the emergency. You cannot let it off. Okay, you have to follow the emergency protocol. Negligence is not by chance, but it is by your neglect. And my words of advice are: adverse derogatory comments should not be there. Okay, if it is there, then it will cause a problem to our entire fraternity or community. Okay, do not joust. Don't let to regret for your comments. Okay, because if you comment or regret over the particular doctor, then that patient may party you with his case, and you have to also follow the court cases. Okay, to keep the mutual respect and dignity of the profession. Now, keep in mind, only a dentist can save you and only a dentist can sue you. The only friend is the dentist and only enemy is the dentist. Okay, so keep in mind, we have to be in the fraternity, we have to be in the united state. So basically, unity among the dentists should support our profession and the colleagues. Together we can, together we will, and we will win. A big thank you to Dr. Dole, my wife and my alma mater, Government Dental College and Hospital, Mumbai. Thank you for patience listening, and Dr. Dole for giving me a opportunity to share my knowledge. And thank you all the participants who are actively listening to my presentation. Thank you. Over to you, sir.
It's a wonderful presentation and no need to say thanks to me, sir. Thank you to all the participants for joining and attending your webinar and listening carefully. It was a very nice presentation. Actually, you are helping others, and the first slide you had put, that is so impressive, and hats off to your efforts, sir, that your goal is not to advertise something or sell something or for any gaining purpose. You're doing it only for awareness. So hats off
One thing
for
I have
that.
to add, sir. I'm doing my PhD in medical legal aspect
Yes, sir.
only, and in that also I have taken a topic that
Okay.
I will give the lecture to the people and make aware them, and will see the change in their knowledge and all the things.
Okay.
Okay, because what I come across that people who are doing practice since ages, or people who are just entering into the profession, are not aware of the legal terms. Okay, after 5 years of legal study, then only I got to know that there are many things which you don't know. We know about the dentistry only, and dentistry is not the only thing which is required for the particular practice. Okay, there are various other aspects like financial aspect, legal aspect. All the aspects are important for the
Yes.
dentistry. Over to you, sir.
Sir, if we organize a lecture, would
Hmm.
you be interested to come and deliver a lecture here? 10
Yes, yes, sir.
participants. It will be free, right?
Yes,
I'll organize it. We'll
yes,
just
sir. No
limit
problem.
it to 10 participants. I'll get back to you over a call after the
Okay,
webinar.
sir. No problem.
Because it is so good initiative by you and we can extend it. As well as I have distributed consents uh, to more than 2000 dentists till now. So I
Okay.
would be interested to send that consent to you through email. There are separate consents, 14 consents are there for 14 different treatments like tooth filling, extraction, implants. Uh, if you want to correct it, because you are expert in that, so you can correct it and I will distribute it and I will add your name in that.
Yes,
Those
sir. No problem.
consents are made by Dr. Sanjay Arora, sir. He's from Delhi. You must be knowing him.
Yes, yes.
Yeah, so I will put both the names. Your name also will be added to that for the credit, and I will keep on distributing it. And even I have distributed it free of cost. Nothing is charged to them. More than 2000 dentists are using it.
Very nice.
So, anyone has any questions? You can ask directly to sir, or you can put it in the chat box. Anyone has any questions? And to add to this, sir, there are participants from Malaysia also.
Okay.
I have done a tie-up with Malaysian association, a Malaysian Private Dental Practitioners Association. So those
Okay.
are attending all the webinars starting from your webinar.
Okay, sir.
This will go on YouTube because I have recorded this.
Yes.
Okay, so that will be put on the YouTube channel and the link will be shared to more dentists in Malaysia. More people will attend. And one question is there, sir, in the chat box.
Hmm.
I'll read it for you. There are appreciations also to you. Thank you for the presentation from Dr. Nikhil, Dr. Anand, Dr. Yashpal, and Dr. MJ. Thank you everyone for commenting. And Shweta, Dr. Shweta wants to ask you, sir, will you please
Hmm.
share the consents with
Consent.
us? Yeah. Yes, yes, definitely. That's what I was talking to sir, that I will first send him. He will correct it if any corrections or additions are there, modify it more lawfully, and then definitely it will be sent to you. You have to send your email address in the group. The group is formed for this webinar. So please share your email ID in that. I will send you through email because it cannot be sent on WhatsApp. It has to be sent by email only. A lot of data is there. So fine, okay, we can end this. And next Sunday we have on 8th of June ADC webinar 173. That is to be presented by Dr. Suchita Vanjari. Uh, and the topic I'll tell you. Maybe I forgot the topic. Yeah, Think Pink, mastering soft tissues around teeth and implants. So many people wanted to attend the webinar on implants. So most of the content will be, half of the content will be on implants. So you can attend it, and we will organize the separate webinar for implants to be presented by her only later on. So thank you everyone for attending, and thank you, sir. Thanks a lot once again. And I
Thank you,
appreciate
sir.
your efforts. Congratulations to you for everything. And I will get back to you on call.
Yes, thank you, sir. Thank you, everyone.